Today, I'd like to talk about sleep. I want to go over some of the amazing things that cannabidiol can do for improving sleep, as well as improving wakefulness, what we think of in terms of inducing sleep, but we have to look at it also as wanting to maintain our wakefulness as well. And so it's a contrast, but it's also a benefit for cannabidiol. First off, in our agenda today, we'll look at the burden of disease for sleep disorders. We'll talk about the conventional cause, the way it's looked at, as well as the treatment. We'll talk about the endocannabinoid deficiency that seems to be characteristic in so many of these health problems of the modern era. We'll talk about evidence for cannabidiol, and we'll review some of the serving sizes and management of patients, and I'll provide some references and take questions as well. Now, in terms of the burden of disease, we're seeing on the order of 30 million people in the United States at any one time experiencing major sleep disorders and difficulties. If we're talking about in terms of the total cost, we're seeing as much as $7.5 billion, which has been the estimate. That's not to mention the lost productivity that is seen with sleep disorders, from the inability to work efficiently and effectively at the job and produce the desired results. In addition, there's some extraordinary diseases that are present and accompanying sleep disorders of all kinds: obesity, diabetes, heart disease, hypertension, and there are a number of others, including dementia. Furthermore, there are problems with addiction, because many of the drugs that people are started on actually have some major adverse effects and addictive components to them, so that we end up creating more problems, sometimes from the therapy that's involved. If we're looking at the different pathways of disease and we're talking about the different sleep disorders, these are a few of the many that are involved with sleep problems in this particular category. There's sleep deprivation, typically from your cyclic work schedule, doing shift work. Insomnia in general is a major category of people not sleeping or not sleeping well. The restless leg syndrome, where the leg seems to jerk out in particular motion and it's an involuntary reaction. The REM sleep behavior disorder is a very interesting one that is a precursor to perhaps some major disease. What it amounts to is a striking out or a fighting in one's sleep. When people are asleep, they're generally paralyzed or they're atonic, their muscles aren't working. So for someone to go through an aggressive behavior and slug or hit somebody, this is not that uncommon. This is occurring, and it does seem to have a predilection and a predisposition to developing other diseases later on, like Parkinson's disease and dementia. In addition, I think everyone has heard of narcolepsy, where somebody is awake and the next moment they fall asleep. So you have quite a variation. And finally, probably the biggest one, of course, is sleep apnea, where we have millions of people who are involved with sleep apnea. They're not able to maintain the respiratory rate while they're sleeping, whether it's a peripheral issue occurring in the mouth or the throat or the airway, or it's central, run by the brain. One of these factors is making a major impairment and is requiring people to use devices to help them sleep and to maintain rest, or the sleep apnea is interfering with their sleep altogether. So it's causing a lot of that sleep deprivation issues that we see. The conventional treatment at the present time is pharmaceutical drugs. I don't think anybody's got a good answer for why this is happening. There's a great deal of discussion about cognitive behavioral therapies or psychotherapy, as well as doing good sleep hygiene, keeping the bedroom clean and neat and making it exclusively for sleeping rather than other playful activities, watching television, entertaining. Those types of things that may not be appropriate for a bedroom, keeping the bedroom strictly as a place of rest for continued sleeping. The other area is herbal remedies, and the threat of the medications in terms of side effects is discouraging enough to leave those to the last, and people are looking for herbs and spices and things like melatonin that could be very helpful for them and improve their sleeping quality. Also, something called GABA, G-A-B-A, is sometimes used to improve the sleeping, but they don't always work and they're not always effective. And so in some cases, we also have the devices, and I mentioned the CPAP breathing machines that people use for the sleep apnea. Looking at the endocannabinoid role in this disease, we're seeing quite a bit of correlation with a number of factors within the endocannabinoid system. The endocannabinoid system is pervasive throughout the body, and it's regulating the hormones, it's regulating appetite, regulating the stress hormones and the body's reaction, but it's also regulating sleep. And this has not been much in the way of general knowledge up until more recently, but there's clearly connections and important factors. In most cases, what we're seeing is an increase in the actual endocannabinoids, like anandamide, and a decrease in the number of cannabinoid type 1 receptors in these particular areas within the brain that are so key for the sleep programming that we go through. In terms of the hormones that are within the brain, the cannabinoid system is interacting with these hormones and reducing or increasing the levels and making modulations on the cells that produce those particular hormones and thereby affecting their secretion rate. Orexin is something you may not have heard about, but it is a key hormone or substance that is involved with keeping us awake, so that when this particular substance and these particular receptors are not working properly, that's the problem related to narcolepsy. If we're looking at the pathways of disease, let's go through some of the fundamentals of sleep and how this works. Number one, you have wakefulness, and that's where you're attentive, you're alert. Now, during the phases of wakefulness, you are able to maintain it, but gradually some hormones are being secreted during this time that will gradually build up and influence the body towards getting very sleepy and very tired. And the cannabinoids are definitely involved in this particular process. And then if we go into our normal sleep pattern, the diagram at the right does display and show you the 4 stages that are considered in sleep: the non-REM sleep, and then the REM sleep, the rapid eye movement phase. So your first phase is typically where it's a light phase and the brainwave pattern might be considered as alpha waves. And then you go on to the stage 2 and stage 3. The brainwave patterns shift slightly, but you have different physiologic functions that are occurring there. But about a 90 to 120 minutes, we go into a REM phase. It's a rapid eye movement time period. And this is an active area for dreams and creativity. During all of these phases, what you're seeing is a muscle relaxation. And muscles are inhibited. They're not moving. That's one way to keep you quiet so that you're not disrupting your own sleep and keep your muscles out of the activity and keeping from striking out, as well as having some of that restless leg phenomena that occurs with some people. So that's the normal process. Now, what does CBD do in this particular process? What can it do? Well, studies on humans and on animals have shown that clearly cannabidiol increases the total sleep and it blocks anxiety. It's not clear exactly what the mechanism of how CBD does this particular task, but one of the attributes for the cannabidiol has been that anxiety reduction, and that's been clearly connected to the improvement in sleep quality. Now, almost universally, I see sleep improvement in clients who are using the cannabidiol, but it's not the sort of thing where you take the cannabidiol and it makes you sleepy. It helps you sleep, it improves the quality of sleep, but it doesn't put you to sleep. In fact, I'll show you a slide later, it actually wakes you up and keeps you more alert. I know that's a paradox, but we'll go into that. It decreases the amount of REM sleep that you have, but it increases the amount of non-REM sleep. So the non-REM sleep is that where you're getting the deep sleep, the deep, restful relaxation that you need to recover completely from what other activities that you've been involved with. The REM sleep is still there, and the dreaming phase is still present, but is not as much. Remember, I said that the total sleep actually increases, but the REM sleep is decreasing. It blocks sleep rebound and hunger. So if you've ever done some late nights, commonly, and what shows in the studies is that people who have sleep deprivation and who aren't getting the adequate amounts of sleep develop quite a bit of hunger the next day, and the hunger is well beyond what they normally should be having. And that can lead to a cycle of increased eating and, of course, a rebound in the amount of sleep that they need, so that they miss several nights of sleep and then they're trying to make up for all of the sleep that they missed. So there's a compensation that the body tries to set into place. What cannabidiol can do is block that particular effect, so there's no rebound. Your body doesn't have to make up for that missed sleep, and you don't have to compensate one for one for every hour that you miss. It's also blocking the hunger aspect that goes along with it. So pretty clear that the endocannabinoid system is very closely involved with what's going on with regard to sleep, but also with regard to hunger and the appetite that goes and is associated with it. It blocks restless leg syndrome. So it blocks that additional movement. It seems to interfere with the brainstem and the inhibition. Rather than interfering with the inhibition, it is facilitating the inhibition of muscular movements. And that goes as well for the REM behavioral disorder, where people strike out and injure their sleeping partner if they're next to one. It also increases the airway muscle tone. So this has particular application with regard to sleep apnea. So the muscle tone in the tongue and in the mouth and in the airway is improved, and it may decrease the likelihood that there will be a sleep apnea, that there will be any obstruction in the airway. It also seems to improve the airway response, and it also seems to improve the brain's response and prevents the apneic episode from occurring in the first place. So you have another number of potential benefits. In terms of proof about the CPAP, I don't believe that for cannabidiol has been shown specifically in patients to be effective for sleep apnea. And I don't have any patients who personally have reported a specific improvement in that regard. However, the science is encouraging that there could be a potential, and trials could be done for that particular problem. Now, let's talk a little bit about wakefulness. Now, I've pictured the Greek god Janus here because this is a two-faced god. And they have two faces, they have two aspects, and that's what we see with cannabidiol. As in such a paradox, that cannabidiol is such a paradox because not only does it improve wakefulness by the daytime, but it also improves the quality of sleep. So it's complicated in terms of how that happens, and I'm not sure that there is a clear explanation, but that's what is being showed. That during daytime activities and the normal active time period, your executive functions are sharpened. Your focus and your reflexes are at their peak. In addition, you're seeing an improvement in your vision, your taste, and your smell. All these things are going along. At the same time, you're showing reduced anxiety and reduced pain. Now, in contrast, that when you go to sleep, when it is time period for going to sleep, then you have the total sleep duration is increased with a decrease in the REM sleep portion of it. So you're getting deeper sleep, and a more effective sleep for recovery. It's an interesting play, but that CBD does have on the physiology, but quite well spoken out by science. If you're going to be using cannabidiol for sleep, I don't have any specific dosage that works best, so you need to find out what works best for every individual. I usually start with a basic of about 15 milligrams twice a day, and then increase the dose as needed to improve the sleep quality. But remember, you're also improving the wakeful quality. You're improving the executive function that people exhibit while they are awake. Sometimes those are things that I can see directly as I speak and I work with individual patients. It doesn't matter what form that it comes in, they're all effective. Typically, the duration of action for the CBD is about 12 hours. I only advise one to avoid the cannabidiol right before going to sleep, because that aspect that improves wakefulness could interfere with your sleep quality by getting you to be in an active mode for the brain so that it doesn't want to relinquish that active and mental activity to allow itself to go to sleep. Again, almost universally, patients will report improved sleep quality when they start using CBD. Now, there are exceptions to this, and I have encountered a number of patients who have an undisclosed diagnosis. I'm not sure what that represents, but it tends to run in the family, and it is a primary sleeping disorder where they claim that they are getting less than 2 hours per night of sleep. I think that's, once studied, I think it would show that these are chemical imbalances in the brain rather than pure anxiety issues that are going on. But I'm not sure about those. Those primary insomnia difficulties that have been going on for decades for individuals have not responded well to cannabidiol, although I would see the other benefits being available for them for the improved relaxation, the improvement in anxiety and depression, and their mood that would help them, as well as the analgesic effect that CBD offers. So let's go over some of these benefits. We're talking about the huge burden of sleep disorders that's out there and the role that cannabidiol could play in improving the quality of life and the productivity of America. The endocannabinoid deficiency is quite common. We're seeing that in the sleep disorders as well as so many other disorders. And cannabidiol addresses all the pathways, the important pathways of sleep, and actually much more. CBD is supported in preclinical studies, and in my practice, I can tell you that 75–80% of people report improved sleep quality, and nobody has reported a worsening sleep pattern. There's no adverse effects, there's no toxicity, and there's rare drug interactions that can occur. And you also have that benefit, and I didn't elaborate on this before, of avoiding those drugs or even removing and eliminating those drugs, particularly the benzodiazepines and the antidepressants, without going through a large taper period. The addictive component and the withdrawal effects are just not seen in the same proportion that is typically seen without using cannabidiol. The dosing is modest. We're talking about fairly low doses with this, with fast results. I mean, exactly immediate effects. So we're talking about the same night that they take the cannabidiol, they can expect improvement. I don't recommend using cannabidiol right before sleep. So, or just using it as a nighttime dose. Although that's a possible option, I think that they miss the other benefits that are related to that. So that's the thrust of my topic and the general information. I've listed out here my slides and references. If you go to this particular folder on the Google Drive, you can access these slides in particular and see the material and review that material that's there. I've also listed out my notes and the references that I did for this particular report. So it was delightful talking to you, and as always, I learned so much from reviewing this information and going over these particular isolated and special topics for cannabidiol and how the endocannabinoid system works in the body, and the extraordinary benefits that cannabidiol could offer to our country and you as an individual and all of your patients.